I've looked at the web. I don't usually do that, but I've looked at the web, some of the anti-vaccination websites.
And which of those sites did you look at?
Oh gosh. Here's one called Vax Truth. Everything you ever needed to know about medical exemptions to vaccination but didn't know to ask. There were a couple of others that I looked at, many of which were appalling.
And why do you believe they're appalling?
Because they're ignorant of the facts, exaggerations, half-truths, or even misconceptions.
If somebody were opposed to vaccines because they believed there was insufficient data for them to make a decision about the actual risks, not the benefits, but the risks, would you consider that person an anti-vaxxer?
If they refuse to be vaccinated themselves or refuse to have their children vaccinated, I would call them an anti-vaccination person, yes. If they're individuals who are immunosuppressed, for example, and therefore have a contraindication to certain vaccines, that to me would be a reasonable decision on their part.
Okay. But otherwise, you believe that anybody else who refuses a vaccine is doing so based on misinformation?
Generally speaking, yes. I can imagine an adult deciding that they don't want the advantages of vaccination for whatever reason. If you're a healthcare worker and you refuse to be vaccinated against diseases that you could potentially transmit to patients, I don't think you should have the option of making that decision.
At the most recent ACIP meeting, you spoke and gave ACIP 3 pieces of advice, correct?
Yes.
Right. One of them was to conduct more vaccine safety studies to prove the anti-vaccinationists wrong, right?
Yes, correct.
Okay. If the science to prove vaccines safe already exists, why would more safety studies be needed to prove the anti-vaccinationists wrong?
Because there are so many people, as you can see on the web, who have these beliefs about vaccines, and as we have discussed throughout this long day, it would be valuable to have more safety data.
Like a vaccinated versus unvaccinated study, correct?
If such a study is feasible.
Shouldn't vaccine safety studies be done for the sake of making vaccines safer, not for the purpose and with the predetermined objective of proving so-called anti-vaccinationists wrong?
I support more research on every aspect of vaccines.